Hey guys, Rick Wilkinson here from the Motivated Paramedic. Today we're going to talk about epinephrine. We have epinephrine 1 to 1,000, we have epinephrine 1 to 10,000, and if you're allowed in your protocol to mix 1 to 100,000, that's also a formulation that's very common in EMS. So let's talk about the two that we use, then we're going to talk about the one that we should probably use more of. So epi 1 to 10,000, probably the most common epi that we use. That's for cardiac arrest management. 1 to 10,000 normally in a pre-fill. Sometimes you have to mix your own, understand, but 1 to 10,000 concentration is normally given for cardiac arrest every 3 to 5 minutes. Now we may see some changes coming up in the fall with the ACLS algorithms changing, so we'll just see where that is. But right now we have 1 to 10,000 every 3 to 5 minutes per ACLS guidelines, and there's no max. So if you're resuscitating the patient, then we give it. Mostly common given IV IO. In extreme cases, you can still give it down the tube, but that's a large amount of fluid, and I would highly suggest finding an access of some kind, whether it be IO or IV. Some agencies will allow you to mix 1 to 100,000 on site or on the ambulance to make you a push dose pressor. Normally used in like a septic patient that has very low blood pressure, and you don't want to just throw a ton of fluid at them because they already have complications from that. But the one I want to talk about today is 1 to 100,000, or excuse me, I apologize, 1 to 1,000. 1 to 1,000 epinephrine normally used in anaphylaxis. Most people were educated that 0.3 for an adult dose is the one to use for like an EpiPen or anaphylaxis. IM injection, no sub-Q, just straight IM. But I think a lot of people also don't give enough epi. Probably we need to give more, because I think so many people were kind of made to believe that it was so scary to give that they wouldn't give it. For example, I was educated that if they're elderly, you could put them into cardiac arrest, you could give them a heart attack, you could put them into an arrhythmias, which those are all valid side effects. So which would you rather do? Would you rather wait for them to arrest and then give them 1 to 10,000 epi when they're in arrest, or give them 0.3 of epi when it's appropriate for their anaphylaxis, and then manage those side effects for 3 to 5 minutes till the epi wears off? Again, following your local protocols, doing what your medical director says is right, is what we need to do. But overwhelmingly, I think many people are scared to give epi, and there's nothing wrong with giving epi when it's appropriate. But don't forget, if you have a true anaphylactic reaction, epinephrine is the #1 drug of choice. Giving Benadryl, giving Solumedrol, corticosteroids, an H2 blocker, even fluids, yes, that helps with an allergic reaction, but epinephrine stops the allergic reaction and allows the Benadryl to help with the histamine release. Steroids will suppress the immune system so that allergen doesn't react as well, and you can hopefully decontaminate them, and the fluid obviously will help the blood pressure. But epinephrine is the drug of choice for anaphylactic reaction. So yes, if they're elderly, you are going to have some pre-thought that could cause some tachycardia. Somebody with a long history of MI, yes, they could have some issues there. But also thinking that if they don't get this epi really soon and their airway closes, then they're going to arrest. Yes, this comes with experience, this comes with following your local protocols, but also looking at the picture as a whole. When people say, well, he has a rash, he's itching, I'm going to give him some Benadryl. Okay, well that would be appropriate. But anytime it involves the airway or the tongue, that's epi time. And again, follow your local protocols. But I tell my students and my people that I train is that when they start going from, hey, my tongue feels funny, that's the time to give epi. So if their speech pattern changed in front of you, or their family member says, that's not normally how he speaks, he's speaking very thick and almost sounds like he's had one too many alcoholic beverages and your tongue gets loose, but he normally doesn't sound like this, that would be the time for the epi. Because if their tongue is swelling to the point where their speech is now changing, that's the time to address it. Benadryl is too late then. Solumedrol is too late then. Corticosteroids take time, and really that just suppresses the immune system in the hope that that allergen doesn't kick in as much. It may do some other things with swelling as well. But epi is the answer. So don't be afraid of epi. Use it appropriately, but also understand that those side effects are there. But would we rather use a little bit of epi, manage those side effects for 3 to 5 minutes, or wait for this person to go into cardiac arrest and then use 1 to 10,000, and now they're in arrest. So just a quick blurb on EPI today. Hope you guys have a great day. Stay motivated, and look forward to a live probably in the next couple of days.